Shall we start? Sorry.
Good morning, Ajahn and my classmates. My name is Nantapon Chichiko. My topic is association between high healthy eating index and cardiovascular event and mortality in electricity generating authority of Thailand. The outline for today is budget, ethical consideration, and successful grant application. Please let me recap about the objective. Objective of this study to assess the association between high healthy eating index and cardiovascular event in EGAT study and to assess the association between high healthy eating index and all-cause mortality in EGAT study. For this study will conduct in EGAT 1, EGAT 2, and EGAT 3. Exposure is low healthy eating score and high healthy eating score. Outcome is cardiovascular event and all-cause mortality. The estimate budget for this study will be 100 baht. That will consist of study relevant cost For IRB approval will be 5,000 baht, and for the research material will be 5,000 baht. For the manuscript publication will be divided into two parts. The first part is English edition will be 500 baht, and submission fee will be 7,500 baht. For the patent related cost is no cost because of this is a cohort study. For the data related cost will be divided into data entry cleaning that will give only one time and will be 10,000 baht. So for the estimate budget for this study will be 100 baht, 100,000 baht. For the ethical consideration will be divided into three parts. The first one is respect for person. Second one is beneficence, and the third one is justice. For the respect for the person, this study is retrospective cohort study, so it will be no informed consent. However, the study protocol will undergo approval by the Ethical Consideration Committee of the Faculty of Medicine, Raamath Hospital, Mahidol University, Thailand. The study will be used study ID for analysis. Any personal information, including name or hospital identification number, will not be utilized for analysis. The confidentiality of the study participant will be maintained at all times, with no disclosure of the identity in any published materials. The result will be presented in an aggregate manner to guarantee their privacy. Additionally, all data files will be safeguarded with password protection. For the beneficence, for the risk and benefit assessment, the study and procedure will not pose a risk or burdens. For the benefits, all two participants will not directly benefit for this study, but it does offer an opportunity to enhance our understanding of the relationship between the Thai Healthy Eating Index and cardiovascular event and mortality within the Thai population. For justice is none. For the potential funding source, the first one is graduate research scholarship from graduate education session, Faculty of Medicine, Raamath Hospital, Mahidol University. The second one is graduate research scholarship from the Faculty of Graduate Study, Mahidol University. The third one is Thai Health Promotion Foundation, and the last one is International Health Policy Program, Ministry of Public Health. This study will be conducted in 2 years. For literature review, will conduct about 9 months, and protocol writing will be conducted in 3 months, and defense research proposal will be conducted in 1 month, and submit for ethical board review and proposal will be conducted in the same month with defense research proposal, and for the data entry and cleaning will be conducted in 1 month. Data analysis and conclusion will be conducted in 6 months, and for report writing will be conducted in 3 months, and for manuscript publication submission will be conducted in 1 month. For overall study will be conducted in 2 years. Thank you for your attention.
student any question from student question but the first one is not about budget and today topic you go back to the earlier slide just want to comment that your arrow of the direction of the study maybe need to reconsider, right? I think that the last session, Ajahn Amarin, or I don't know, but we already comment to your study design that your study design is not retrospective cohort study, but prospective cohort study, not retro. Because your study, you will use the data from EGAT study that is the prospective cohort, not retro.
Excuse me, Ajahn. But I remember that I'm not sure that I remember correct or not, but I remember that Ajahn Amri says that EGAT study is prospective cohort study, but for my study is retrospective cohort study because
No, you will use the data from EGAT study, but this is not the retrospective, right? You will use the data that already correct from the cohort EGAT cohort study.
thank you.
Retrospective is not planned, right? You have to collect the data that already happened in the past, such as you collect the data from hospital database, medical record, and you extract the data and use the data from the hospital database. But the EGAT cohort study, you plan and you collect the data in the future, right? But you use the data from this study that already collect. Another comment is the any any statistician expert statistician consultation you include that budget in your budget plan. Will you include it?
No, because I think in our faculty we have the statistical consultant, so we can register and consult with the statistician for free. Or we can discuss with our advisor or Ajahn.
Questions about the cost for data entry. I'm not sure that whether you have to use data entry because it is already the data is already in the database, right? Or even if you really have to do the data entry, will you consider the double data entry budget for two people? Thank you.
For data entry that I include the budget, I think if some data is missing, I will ask them to record it again.
Ask who to recall? Ask who? Ask participant or ask who entry the data?
The data collection team
To recall of what?
to recheck.
You go back to the data record form or
Go back to the data record form.
To check that is the error typing error or something like that.
Yes.
And will you do that to every patient, every people, every person's data? Or when will you do it?
When have the double entry and if cannot make the decision, I will check that person.
To the study participant and ask them again.
I will consult with the data collection team first.
Consult
For make sure that the data is correct.
But you will act as the head of everything now because it's your own project and you will be the one who will make the decision, not everybody else. So not anybody else. So you should be able to judge. But Jan Tanyarat's question is that how to judge when something is wrong and you need to assess you need to have the access to the primary data source.
If I have to adjust, I will go back to the data record form.
for budget today. So, for the data entry and cleaning, the number of your participant is 4,000 and unit cost is 10,000 per unit or not?
Yes, I think I will give only one time.
Data entry, you will lump sum, you will pay to the people who key the data, right?
Yes.
So you will pay per data record form or you will lump sum the cost?
I will pay for overall data.
So if you pay for the whole data, not calculate for the cost per data record form.
Yes.
And for the ethical consideration, you said that this study do not need the informed consent, but the patient have to sign the informed consent, right? Because it's not the routine clinical practice.
Yes, but because of the data that I got, no need to ask the participant again. But I will submit the protocol for the ethical consideration committee.
Okay, but that we already comment for the study design that for the ECAT cohort study is the prospective cohort and all of the patients have to sign the informed consent first. even you use the data from this study, I think you should present for the ethical consideration.
I have another point about the IRB approval fee of 5,000 baht. As you are one of the also a member of faculty as well as a student, so I think the EC Ethics Committee doesn't charge you for this 5,000.
I have a question. If the last that I submit the EC, if we have the scholarship, we don't need to pay, right? But in the past, when I submit the EC, if I have the scholarship, I have to pay for the EC.
So, what scholarship will you apply for? You said at the end, but it's like potential sources. You don't seem to commit to apply for any scholarship or grants. So, do you plan to get a grant for this study, then have the EC fee?
I think if I got a scholarship from the one and second, the IRB cost will be free. But if I got a scholarship from the third one and the last one, it will be include the IRB free.
Okay, so actually this slide is relevant to the cost, so it should be presented right next to that one. So presenting at the end may give us some confusion.
For the ethical consideration for justice, you said that no, because it's cohort study. Can you explain more? Why cohort study is not necessary to consider for justice?
Because I think is none of the subject selection.
What does it mean for none of subject selection?
Because this study have not to select the subject.
It means that all the participants, all the people can be recruited in this study equally, or they can, right?
All participants in EGAT employee can enroll to this study.
You have to explain more. It's not none, but you have to explain that why this study consider about the justice when recruit the participant, something like that. You have to explain more about this.
For the justice for this study, the participants have the chance to enroll to this study, and they have the chance to withdraw of this study when they would like to withdraw.
Of your research proposal, what do you think in your opinion?
For strength, I think because this is a prospective cohort study, it has planned to collect the data that we need. But for the limitation, if some data is missing, we cannot record it again.
And can you say again for the limitation?
For limitation, if some data is missing or is unclear, we cannot record it directly.
This is the limitation of the prospective cohort study or not?
If for cohort study, if for prospective for study, if some data is missing, we can call the participant. In EGAT study, we have the team to call and to record to recheck with the participants.
This is the limitation of strength of your study. I confused. You said that it's the limitation that you cannot recall, but you said that
It is strength for now. I did not see the limitation.
question from student อาจารย์ค่ะ And for your timetable, why the time for literature review is, I think it's too long. You need 9 months to do the literature review.
It will be, if I can do it quickly, it will be reduced to about 4 to 6 months.
But this course has spanned about 2 months. So do you think the work that you've done is not exhaustive enough? Not detailed enough? Is that your opinion? Yeah, we've been through this course for about 2 months now, or even more. About 2 months. So you spent about 1 month in the literature review for this course in defending the topic as well as other parts. So that's already considered literature review. But if you said that you need 9 months, that would mean the work that you've done in this course is not full in yet. So you just did it without much care. Is that the meaning of you presenting this as such? Do you get my point?
Yes.
In this course, you've spent a month or 2 in reviewing the literature as well as giving us presentations. So we expect you to do a good literature review already, and you should have done that in these 2 months. So why it's extended to 9 months in the presentation here?
Because I think for 9 months is for the literature review and for the systematic review and meta-analysis. So I used it for 9 months.
And for data entry and cleaning, why is only 1 month to complete this task?
Because I clean some data. I already clean some data. I mean I just check some data.
In reality, if you collect the data by yourself, maybe this timeline is not practical, right? Because for data entry and cleaning, I think it take time to do. Yeah, 1 month is not enough.
Oh, I just wonder that you have done something with your data without EC approval. You do it before EC approval. Is that should be done?
I have the data about the food frequency questionnaire, but I didn't have the data about the exposure, about the outcome. I didn't have the data about the cardiovascular disease or total mortality. And for the healthy eating index, I did not calculate yet. I just cleaning about the food frequency questionnaire that we collect.
What do you mean by cleaning? You see the missing data, or what do you mean?
I have the data about the Ramat food frequency questionnaire, but it's not convert to the healthy eating index yet.
What do you mean that you do not have the data for the outcome data? So what is the plan to collect this data? You did not write or include this part in your timeline.
Pardon?
You said that you have only the data for exposure, but you do not have the outcome data. So what is the timeline for this task? When you will collect this data, because you have just only the exposure data, but you did not know which patient have the outcome or not, and you have to collect this data, right?
For the data collection, the team has already collect the EGAT team, but I did not got this data yet.
Hello, Namya. So could we go back to the budget table? I just wonder, so here you have English edition for 1 unit, but for submission fee, it's not the same as you submitted, like the version is different. So if you submit this budget to the first potential funding source that you mentioned, that is from our faculty, then normally you can reimburse submission fee, right? So I don't think it's appropriate that you add submission fee here because you will reimburse it from the faculty anyway. So maybe it's not, right? So you won't get this item paid. And for me, if I don't know, if I read your budget and I am a potential grantor and I would feel like more than half of the budget will go to the submission fee, I would feel like why? So maybe you could consider somehow maybe raise the data management cost rather than like the cost for manuscript. For me, it would be more rational.
Thank you.
I think we missed one item, that data collection. Because data collection, you have to spend time. It should be somewhere around between the third and fourth line. Data collection that you have to spend time to get the data outcome data that you don't have it and clean it, right? So this you miss one part, the important part, that one.
Yes, that should be the big part. Now, even though the data now have been collected already, and you really need to spare your time for data management, data retrieval, and data management. And accordingly for the cost, now in case, I think that you may need to the part for data retrieval, because the EGAT data that they have a few staff now who are working on EGAT data and who are providing the data according to the request, and there may be the cost for retrieve data, and also you may need to think of the outcome verifications. The outcome verifications. A few outcomes had been verified, but some other outcomes have yet been verified. And even though a few of them that had been verified, but in case that individual items to verify the outcomes and the data might be contain outliers, and perhaps that you may need to retrieve the hard record, the case record form, and that might be typo error or whatever, or even contact EGAT person, EGAT staff. So something like this that you really need to plan for, even though that you won't have to do data collection by yourself. Now the data have been collected, but working on the data that have been collected, now the attention that you really need to pay for in terms of the outliers and outcome verification. So this part is very important, very, very important. And up to this time, if you're going to go on with this topic, I think that the literature review that you have performed, that should be something, not nothing, should be something that to be continued, should be something that to be continued, not nothing. It doesn't mean that you will have to start to do literature review again and again. It doesn't mean like that. And even you will have to do again because previously that you have yet done properly. It shouldn't take too long time, like 9 months for literature review. If you take 9 months for literature review, that you won't be able to be good researcher, because having been researcher, that we have to move quick and fast, because some other people are interested on the same topic as us. So either individual study, original study, or a systematic review, that researchers must move as fast as possible. So you shouldn't take too long time to do something like this. Or even you want to do systematic review, but you have to think carefully that result of that systematic review, that should be a part of your original research proposal. So you may need to cut some of your systematic review, or you may need to move as quickly as possible in order to get the proposal for original research properly. So it shouldn't take too long time. And you pay less attention for data retrieval, for data management, and that really the main contribution, the main time consumed when you work on research. You should not underestimate underestimated for this time, for this procedure. It's really time consumed before moving to data analysis.
Thank you very much. So for the next presenter,
Thank you for your comment and suggestion.
May I ask before everybody else's presentation, have you prepared a part of critique of your own proposal, like the strengths and weaknesses? Okay, so in the evaluation form, we have a field for this. So actually for Nantapon, Ajahn Thanyarat just asked you about this, and she evaluated, and we evaluated you based on your answer. So for other students, you may just critique it at the end before we ask the strengths and weaknesses of your work.
Good morning, teacher and my colleagues. So the topic, my topic is
study of the effectiveness between combination therapy and high dose adjustment therapy on urodynamic parameter in spinal cord injury patient, and the design is a retrospective cohort which study into center-based setting, and the study period for 2013 to 2023 recruit, and the sample size calculation is around 1,082 from primary outcome uses for calculation. So it's quite feasible to the setting, and I will apply treatment effect model. And so come to today's topic, my plan time frame. At first, I think like Nantapon, but to answer 2 months later to do literature review and protocol writing, maybe it systematic review and meta-analysis will not, I will not use that data for this primary study. So maybe it's already done during protocol writing, or maybe 1 month spending more for make it correctly. And different research proposal will be planned for 1 month and submit to medical board review and approval for 1 month. And then I prepare team for team of 2 setting, and for plan for data collection, which include one is myself, and the other one in each site, and for 2 months, and also dealing with the data in each setting and do the data entry. I plan for 2 months, and data analysis and conclusion for 1 month, and then report writing and report submission in another 2 months. And for budget, I plan for 3 parts, which is study related, data related, and site related. For study related, because during the master degree, so for IRB submission will not cost, and I plan for statistician consultation, yeah, for 5,000, and project material like buffer for 5,000, and manuscript preparation I based on the senior proposal that include writing manuscript, English editing, and submission fee. And for data related, I plan for data entry, double entry, and cleaning, which will pay for 2 person in each site, allow 5,000 each, and database management consider of the external data equipment for 3,000. And for site related, also for buffering, and I'm not sure, but for site related, for training, talk to the personnel and monitoring, I will spend 5,000 for that, and in total is around 80,200 baht. And for ethical consideration, talking about respect for person, the patient in this study is retrospective cohort, and the patient at that time enable self-decision making to receive or refuse the treatment under the providing information of complication and adverse event. And also in this part, consider confidentiality of the data and the patient identification as the protect data management. And for beneficent and non-maleficent, the study not provide any intervention that may cause potential harm to the patient. And for justice, consider the risk and benefit of research is distributed fairly without creating difference of the patient's group, patient characteristic. Yes, and that will be all. And for strength and weakness of this study, for strength is the use of the already have the data that already have without provide the intervention to the patient. So and use the statistical point of view to find the treatment effect. So that is the strength of we use the previous data and apply statistical analysis to answer the study question of the effectiveness of the intervention. And the weak point of this study, weak point of this study, actually at first I consider of because it is a retrospective study, and we will dealing with the missing of the data, which I think it will be quite high proportion of the missing of the data. But during the statistical analysis, I plan for the imputation analysis and for the report. So they will be weak point that I think of, but plan for manage it. And another weak point is the I'm not sure it is called weak point or not, because actually to consider about the sample size is feasible after just looking crude data in the institute, but it may not may not enough when we do the data collection or cleaning already, because this group of population of patient population is quite low, not much. Even we consider it to setting, so it need to be deal with this, and I consider it as the weak point. Yeah, that will be all, ค่ะอาจารย์ Thank you very much. Any question from student?
You please go back to the table for the budget. For the cost for site initiation, training, and monitoring, according to your study design, for training and monitoring, what is this item for?
Because it's retrospective, not prospective, and I didn't dealing with the site management to gathering the data from the participant, because I use the retrospective data, but I consider as the buffer, like we have two settings, the one with the institute and the one with Raama Hospital. So during the time that need to operate and talk to the team in between two settings, and training for data collection of the data entry personnel. So I sum it up and use it as consider as the buffer also for the management. Yeah. But for but why you quantity of this activity is just only one side, but you have two sides. Why you calculate the budget for only one side for the training, monitoring, and site initiation?
For example, it considered as we undergraduate section of Ramathibodi and Mahidol. The other side will be have the expense to train in that side. So I consider it, but yes, I cannot give detail much whether the building will be what building is. Yeah, I need to reconsider this part ค่ะ
But are you talking about the EC submission fee or the fees for site initiation training and monitoring?
EC submission fee under graduation
I talk about the site initiation, training, and monitoring.
yes
I did
I
not
talk about
the fee.
site initiation also ค่ะอาจารย์
Why you calculate the cost for only one site, but you will collect from two sites for site initiation, training, and monitoring.
อืม at the first I plan I like the main one is in Ramathibodi to manage in the institute. It will cost some money, so I think I will gather that money in this part of budget. But yes ค่ะอาจารย์ we have two sides to answer the reason to use budget. Maybe need to apply into site. But yes, I think of the expense that maybe need to spend between sites นะคะ For example เดี๋ยวค่ะ
Yes, and I think some summation here is not correct. Like in the data related, it's 10,000 plus 3,000 should be 13,000. And then yes, so you can correct.
Just comment about beneficiation. So you I think you didn't mention about beneficiations, right? Actually, at least you have a beneficiation to potential student about your finding of your study, finding a conclusion from your study might be benefit to your potential student at least. So I think you should mention at least these kind of information. And the same for justice, you can add more sentence like, for example, as Jen mentioned previously, you make explicit inclusion and exclusion criteria that is kind of justice, and that result will be distributed at least publication. So it will be benefit, and you distribute this information for benefit of patient, irrespective of their, for example, sex, religion, geographic distribution. And this is a kind of justice as well. So I think you should mention a bit more about this. Thank you.
Oh, thank you.
May I ask a question?
Yes, Mr. Song.
Yes. So you're going to use the secondary data from the hospital, maybe hospital setting. So do we need to ask for permission for that?
Ask for permission, right?
Yes.
I plan to submit for the EC both sides, and during this process, in the other setting site, rehabilitation institute may need to ask for permission from the institute director. Yes, but that will not. Yes, that will not cost. For the IRB submission, you have to cite, but you will not need the submission fee, right? Yes. Submission fee. And for the writing manuscript, why you need the budget for this time, for this activity? For write, you will hire somebody to write your paper? No. Why you have the budget for this activity? I'm not sure. So, during the time that may finish the manuscript that in the form that can use for publication, maybe we need to consult for editing, not only in about language. So I include it, but actually writing manuscript will be done by. But you will hire someone to edit your manuscript for the content, or not? Yes, or you will hire someone to edit the content of your manuscript. Actually, during this time, I should not. I don't have to, but not sure that it's ethical to do or not for not language.
If that somebody edits your content, he or she should be a co-author.
Yes, should be. Yeah.
Early submission fee that you should consider. The rest that is your responsibility. Being students and being the trainer in medical epidemiology, that you should be able to write your own script. Early submission fee. If you would like to add in, but add in is 50,000. But when you decide the budget, you should focus on the budget for conducting the study, particularly for the conducting the study. That you should focus on that. For the site initiation, it could be actually, but you will need to spell out now what activities will be for the site initiation and the meeting. For example, like the site initiation and the research meeting group, and that will need to in order to make sure that the data retrieval is properly and forming the cohort that will take time and we need the meeting regularly. So now you can add the cost according to the meeting, because now when we have call for the meeting, sometimes we have to spend the budget as well, prepare for the budget as well for organizing the meeting. And if you're going to retrieve the data from the hospital to form the cohort of this kind of patients, you have to think of data retrieval and may need to pay for data retrieval as well. And afterward, that you may need to manage the data, link the data, and data management, and the data checking and cleaning. For that you need to think of these activities and which part of this activity that sometimes you may need to ask the IT man to retrieve and to check the data for you. Not just only yourself, that of course that you need to check the data, but sometimes that the data in the hospital that you may need to ask someone else to check the data further as well. And also the outcome verification or adjudication and the outcome, and that may need to ask your residency or your fellow, clinical fellow to do parallelly with you, and sometimes you need to pay for. So think of this.
For the ethical EC consideration, what is your consideration for confidentiality of the data?
The data may need the limit of the access by only the primary author and have the security for access the data and not provide the identification of the patient, the one that may use for during data retrieval only the hospital number, and the data will collect in the form of the identification number else than hospital number ค่ะ
Second bullet, non-maleficent about the data privacy, the privacy and the data protection. Hint or any suggestion for the time frame, I think you should separate prepare team and data collection for the task. Should not be combined, no? And for the data collection, for only 1 month is enough for this task. For data collection, you have to review medical record, right? And fill in the data record form. Do you think it's okay for complete this task for 1 month?
Not enough ค่ะอาจารย์ maybe 2 or 3 months should reconsider ค่ะอาจารย์
And you have to prepare for data cleaning and data checking also. Any comment or suggestion?
Have you mentioned the exempt for informed consent? Exemption from informed consent?
No ค่ะอาจารย์
So do you think this study needs informed consent from individual patients?
Oh, because this one is retrospective cohort and we retrieve the data from the clinical practice data. So I didn't mention of the informed consent from the participant ค่ะอาจารย์
Yes. So do you think your study is eligible for exemption? So you should mention that in the proposal. And in the item for beneficence, here you mentioned only the benefits or harm for the patients, but what about for the medical community? That should be mentioned too.
ค่ะ
Okay, any comment? No comment? Okay, thank you.
Thank you ค่ะ
Morning, Honorable Ajahn and my colleagues. Today I'm going to present you my study budget, ethical consideration, and successful plan application for the study of the effect of denosumab in type 2 DM patient with osteoporosis. And I've changed the PICO framework from the previous presentation through the for the patient for DM and osteoporosis who received denosumab, comparing with patient who got other treatment and no received osteoporotic treatment. And for the outcome, for primary outcome, I have changed to the time to event outcome of the fracture and refracture event. as well as the change of BMD and glycemic parameter in 1 year. And the study designs retrospective cohort study using Ramathibodi Hospital database. And for my study time frame, starting from May this year for protocol writing, about 1 month, and for the defense of the study proposal and ethical consideration, and start the data retrieval in August, and using about 3 months for data retrieval according to the data source might be some SC, and as well as the data entry and data cleaning. After that, I assume that there might be some missing data or irrelevant data, so I spend the most of time on data retrieval and data cleaning, about 3 months each. And for data analysis, I will spend about 2 months, as well as the report writing and the manuscript submission. I hope it will finish in July 2025. And for the budget, for creating the protocol and electronic case record form, which is done by myself, so no expense there. But for project manager fee, I'm not sure I should include it or not, but okay, I will include it for the first time, but it can be adjusted. And for the statistician consultation, for manuscript writing and English editing done by myself, so no expense. For submission fee, I prepare for like 2 submission, like for some worst case, and for IRB approval. For patient-related costs, I think I will not include the expense on this. But for data-related costs, which is for the retrospective data, I think I have to create the cohort which need some data storage. I plan to use like rental server or cloud to store the data, which is about 1,500 baht per month. And for the data retrieval and data cleaning, I may need some more help from the data scientists, and this is the expense for them, as well as data analysis, and this is the total cost of about 300,000 baht. And for ethical consideration, for respect for persons, according to the data which is belong to Ramathibodi Hospital, so I have to ask maybe the director, or I have to write a letter, ask for the permission for using the data. Anyway, the data that I got and retrieved from the electronic medical record will be in a confidential way by the identification, and the data will be limited to only permitted investigators, beneficents, and the result of this study might possibly direct the clinical judgment in the future, such as patient who got osteoporosis with type 2 DM. And for risk of the risk that the patient might face, not directly, but they may have some concern about the confidentiality of the privacy, but I will have to plan well plan on this privacy protection. For non-maleficent, there's no possible risk from the intervention according to the study design. And for justice, the collection of the data will be objective and unbiased. And for the strength of my study, I think this is because denosumab is quite a new drug in Thai population. So the study for the real effectiveness in the real world data is still limited. And as well as for the perspective of the denosumab on the patient, like particular patient like osteoporosis with DM is still limited. So my result of the study might enlighten some treatment protocol in the future. But for limitation of my study, according to this is only one side study, so it might have some biases. And for some immeasurable time bias, which is most observational study face, there might be some immeasurable time bias in the study as well, but I plan for the most various way to include the outcome of the patient, which is the fracture. And this is the end of my presentation. Thank you for your attention.
Thank you. Any question from student and comment?
Thank you for your presentations. Could you please go back to the budget? And another. Next, please. For the data analysis, why is 2 persons?
I'm not sure I have maybe some analysis, maybe some how can the advisor or some, if I need some help, maybe I have to like ask for someone to help for the analysis. But I also would like to do it with myself as well, but I'm not sure that whether I can do it alone. So I just like put it to people here. Yeah, maybe for some help.
Thank you. Tun.
Yes, regarding the risks, you please go back to the risks. So you wrote loss of patient confidentiality of actually and privacy. So I think it is the principal investigators' responsibility to protect the confidentiality and privacy of participant or subject as much as possible. And if you wrote like this, I think you might get quite difficult to get ethical clearance.
So maybe I have to reconsider about the wording here.
Yes, wording.
Yeah, there's still some risk of this as well. Even I'm the intention to like maybe I unfortunately lost my computer or something like that. But yeah, maybe I have to like reconsider about the wording here. Thank you so much.
Question. Can you go to your budget? go back to slide number 17. What is the project manager fee?
I'm not sure whether like this is the
But you should be the project manager. What is the fee?
yes yeah actually this one is quite a lot for like a lot proportion for this budget but actually at first I just like plan for if this is like the plain study that I need to consider about the fee for the manager if it's not me alone but yeah I think I can cut this thing off if I do it alone yes but I just like think of like if this is some study that have to be conducted and need to pay for the manager or how much should I add something
I
like
think
that
it should be the salary for the PI, right?
yes
It should be. Yeah.
yes
Mhm.
but it can be adjusted here I think this is not the main important one here item not main important item here I concerned about the data much more because I'm not sure whether this is enough for the data analysis or data retrieval and cleaning, which is quite hard task.
The data from the hospital database, it should be the data management, right? That the person who will manage your data and merge the data from the different database together from different source. Mhm.
Yes, pay attention more for data retrieval, data linkage, and data management forming the cohort of osteoporosis who receive the treatment. Okay, now which plug on T2D if you are interested in the T2D. But the budget here, even though that you just think of, or perhaps you may use, or you may not use the money for a few activities that for you that you really need to do by yourself. Now, being a PhD student in clinical epidemiology, so that data analysis that you have to do 100% by yourself, and there is no consultation fee for data analysis at all because now your advisors now will be your consultants. Okay? Your advisor will be your consultants. This is the actual one for your study. But if you think of in the future, just practicing now the items that we need to think of, that is fun. Okay? But for your own study, for your own study that will happen, you will have to analyze data by yourself so that you don't have to pay for data analysis. And you don't have to pay for the data statistical consultation at all. Okay. But think of individual items in terms of how to form the cohort, and that you will have to pay for that. For the IT man, for data scientists man, and to help you to link the data to form the format.
มีคอมเมนต์ for ท่าน
And for that item that you can spell out the cost for each, because that is the big item, and then you can spell out the activities that you have to pay for. Okay. And when you work on the big data like this, and now some people, some researchers now will be involved, so that you may need to plan for regular meeting for the activity, regular meeting. And there may be cost for organization, the meeting as well. So you may need to think of this.
Any comment or suggestion? Okay, if no comment, so so Tun, the
Good morning, everyone. Today I'm going to present about budget and ethical considerations. So let me recap something about research question and objective. So this is a research question, and I will find out the comparative effectiveness and safety of combination therapy versus monotherapy based on real-world data. So this is the objective, and this is the PICO framework. For the budget plan, generally there are 4 types of costs, but for my study, I need only the study and data-related cost. For the study-related cost, most of the work will be done by me. That's the reason why I don't need for creating protocol, creating CIF and statistic analysis. But for the IRB approval, I will spend for 5,000. And for the manuscript, for the English edition, it will be 5,000 and the submission fee will be 30,000. But for the writing, I will write it by myself. For the data-related course, I will do it by myself for data extraction, data cleaning, and data management, database management. That's the reason why there will be no cost for that, these kinds of things. So the total cost will be the 40,000 time bed. For ethical consideration, firstly, the proposal will be submitted for approval by the ethics committee of the Faculty of Medicine of Medicine Hospital, and the study will be conducted after approval from institutional review boards. The study will follow the 3 fundamental ethical principles, such as the respect for persons, beneficence, and justice. So for the respect for persons, this study will use the secondary data analysis for the hospital database. And that's the reason why, firstly, I will ask for permission to access the database from the hospital setting. And I will also ask for waiving the informed consent from the ethics committee. For the confidentiality, collection, storage, and handling of the patient data will be done in a confidential manner. For example, data will be de-identified, and the data will only be available to the principal investigators. Regarding the risk, this study will give the benefits to the society regarding knowledge about the clinical effectiveness of PAH targeted therapy for patients with PAH. There will be no direct benefits to the study participants, but the results from the study could be used for development of clinical practice guidelines in the future. Regarding the risk, there will be no additional risk to the patient from participation in the study. So for the justice, the collection of data will be done in an objective and unbiased manner. For the funding source, I checked the Maido website, and we can apply for the scholarship, and we can end for 30,000 for the master degree students. So I'm going to apply for this grant for this study. Thank you for your kind attention.
A question from student.
I'm sorry, I forgot to mention about the strength limitation. So this is the retrospective cohort study. So we can come across with the missing data. But in the analysis, we will do the multiple imputation. So I think I can control the missing data to some extent. For the strength, this study can analyze the comparative effectiveness of the study. And I can say that this is the first study because I reviewed the previous study and they use the real world data, but they only describe the data, but no analysis. That's the reason why this study will be the first for analysis of the comparative effectiveness of the different kinds of pH targeted therapies.
Question from student. Sirilak, do you have any question? Mr. So please go back to the budget plan. I cannot catch up at the time. Another slide. The next one. Why Mr. Saw plan no data related cost? Your study is retrospective.
Yes,
Yes.
retrospective study, but I plan to do it by myself. And if I have some problems, so I will consult with my advisor. That's the reason why I do not spend any money on the data related cost.
It by yourself for all.
Yes, I will do it by myself.
But will you use the database from our service system?
Yes, I will use the database from the Remedy Body Hospital, Maido University. Yes, actually.
And will you have to collect the data manually by reviewing the medical records, or use the data from the system only? Or you may have not get exposed to the data in our hospital. We have two separate systems. The medical record itself is primarily recorded as image files. So doctors still write on papers and they get scanned, and the clinical information that are literally clinical, I mean, by that I mean history and physical examination findings will be written and scanned, and those will not be available in the database, but will be available only as images. But other data like diagnoses and medications and drug medications and lab values will be stored in the database system, and those will already be computerized, but not the clinical findings. So my question is, will you have to get access to the medical records that were scanned?
And firstly, I will use the database, electronic medical record database system. So if I cannot find the data, so I will check the scan data that you mentioned.
And if it was the first case, if you don't need to get access to the scanned data, you will have to use the service of our data scientists, and that should incur some cost. Because
Yes.
you wouldn't be able to do it by yourself only. And if you had to access the scanned medical records, you will still have to hire somebody to do it because first, you are not here. Second, they are written in Thai, hardly. And
Yes,
you may
thank
not
you for the command.
Yeah.
So I will add,
understand all of those.
yes, I will calculate the cost for these kinds of matters. Thank you for your comment.
And even though that you now will have to do data extraction and data cleaning and data management by yourself. For data retrieval, if you're going to form the cohort now, the cohort of pulmonary hypertension, so that if you link, because now you're going to identify the cases now of pulmonary hypertension, and that if you try to imagine that now to retrieve now the data, you may need to retrieve now about 2 or 3 or more than 3 sources now in order to now link the data and identify the cohort at the beginning. So to do this, that you may need data scientists to help you now to retrieve the data and forth and back and forth and back, and that you now if you're going to apply for funding to conduct this study, and you may need to think of the payment incentive for this part as well, and the rest that you can do by yourself. But you really need to mention clearly in terms of data extraction. Data extraction, now how many variables now will be extracted or constructed based on hospital system or based on manually extraction from EMR, review case by case, or now you can form by data linkage. Now someone data scientist now retrieve the domain of the data, and then you can extract from there data lake there straight away. Okay, so you really need to mention here clearly whether you will do data extraction manually, and if this is the case, that you may need to pay for because you are not here, as Ajahn Kulawat just mentioned. But if you mean that you're going to extract information from the hospital system, computerized databases in the hospital, and that may be feasible for you to work on online from there. Okay.
Thank you.
May I know a little bit more on the data that you collect? Are there any kind of data that is collected in the machine, or because your work is about pulmonary hypertension, right? I think probably there might be some kind of data that may need to retrieve separately from the machine, something like that. So if you are going to conduct, probably I think you need to explore on the way to get the data as well. If you're going to conduct this kind of data, that's just my suggestion, because I have some experience with retrieving the data from like a closed source machine, like in the ICU. They require the specific software from the manufacturer, and it requires some some like some fee from retrieval for the machine. If you're going to conduct the study that require the data from the machine, might need to consider this sort of cost as well. Thank you.
Thank you, Ajahn.
ทีนี้คอมเมนต์อาจารย์เหมียว
So to I saw your slide that you said just for the slide number 13 that the ethical consideration that you said you are going to use the exempt the EC and you will correct the data with the only available to principal investigator that is you, right? So I think you might not just too much specify like this, like only available to principal investigator because just only you that you can deal with the data. So you might allow other people, but you have like password protection, something like that. Okay. So that could be more feasible to other people to get to the data. And for your budget, that you said you are going to apply for IRB approval because we might not charge you because you are a student. And this is the project that under the training and for the data related cost, I agree with all Ajahn that this is going to because our data now is quite widely dispersed, so you have to form the cohort and you need spend more money to deal with that. Okay, so this thing you cannot do it by yourself. I think for data related cost, even me, I think it's quite difficult. Even I am the person who are in the hospital. So I think you need to be careful on this cost. And for the strength and limitation that you didn't write here, but you said that the strength of this study could be applied to the guideline development. I think the guideline development should be based on other factors as well. So you might say that you might provide the knowledge that related to your objective, that you compare the effectiveness of 3 intervention. So you might say that you provide knowledge or the fact that which one is better, but maybe apply to the guideline depend on other factor, more like the reimbursement or whatever. Okay, so this could not be generalized to that guideline development. And the limitation is you have to think that which one can limit your successful to this for you to get the successful conduct this research. Like let's say because you have to identify the PAH patient, that you need some expert like a pulmonologist, cardiologist to help you to identify this PAH patient. And also the data that you have to be get from them. It might be like the data that in the database that not a problem, but for the data on the clinical part that you might need that. that limit, that is some limitation. And that could be reviewed by EMR, but you yourself not here, so you might have to other people to help you on that one.
So I add from Ajahn Papakorn that in terms of another limitation of the study, even though that we and you try to identify the cases here, pulmonary hypertension as much as possible, and then to verify if cases are cases. According to the data based on hospital or computerized data that allow you to ascertain that there are pulmonary hypertension cases, but the definite diagnosis. Now, there should be some patients who might be coded or who might not be coded according to the ICD-10, but they received the treatment, and there is no additional data to confirm diagnosis. And whether you will consider them or with the consensus of the team, consider as potential or possible cases. And then you include into the analysis, and therefore there may be misclassification of pulmonary hypertension. That is the first thing that you work on the cohort that you really need to think of. And you want to assess the treatment effectiveness for the treatment of this pulmonary hypertension. But now you work on observational data, cohort data, non-randomized controlled trial. Even though that you will apply statistical analysis that as known as like propensity score analysis, whatever type of propensity score analysis, and you cannot control for unknown confounding factors or known but no data. So if you think of the equation, the outcome equations and the treatment equation, particularly for the outcome equation, the residue of that outcome. So the residue of that outcome is from unknown and known without data, combine them all together, in which non-randomized controlled trial cannot be controlled. Just fully randomized controlled trial can be controlled, known and unknown confounding factors. But the propensity score analysis could do only known with data that you try to balance if the assumption is old. So you may need to point out this with this as well. And also working on propensity score analysis need a few assumptions. And if that or those assumptions are violated, so there might be the biases, particularly for confounding biases occur. So you may need to prepare yourself, because we don't know what's going to happen, but you plan for. And if you are lucky that all assumptions are comply and achievable, shouldn't be less problem. But for the uncontrolled confounding factors or unknown confounding factors that you need to mention, work on analysis based on real world data. And the missing data that you have to mention for everyone work on real world data, you want to be able to avoid missing data. But it will be less or more number of missing data, and it will be biases less or more. It depends on the type of imputation or whether you analyze based on complete data only. So that you have to think of this as well.
Thank you, Ajahn.
Any comment คะ So for the last presenter, Thun.
Okay, good morning, gents and my classmates. Today, I would like to present the budget and ethical considerations of my research proposal, moderate intensity or high intensity studying for coronary artery disease in high population. Okay, so this is the outline of my presentation today. And the research question and the outcome, primary is MACE, secondary is the individual components of MACE plus LDLC level, target achievement, and the safety outcome as well. And this is the exposure definition, high and moderate intensity study. For ethical consideration, so because this is retrospective cohort studies, I think it is quite impossible to get informed consent from participant. Because I will retrieve the data, such as patient social demographic data, the medical history, medical data, laboratory, and death certificate, or maybe medication dispensing data from Rama Hospital, Rama database. And I will get IB approval for my proposal, for my research. All the research will be conducted in accordance with Helsinki Declaration. For some domain like respect for personal autonomy, so I want to make sure that there is minimal risks and protect the rights of the subject and the welfare protection as well in terms of privacy and confidentiality. For example, by anonymizing the patient's identity or other unique identifiers like detailed address of each subject. And the storage of the data will be in password protected, highly secure encrypted storage device with access to authorized person like PI and data analytic team. And I will try to ensure compliance with PDP, Personal Data Protection Act of Thailand. In addition to that, there will be no physical examinations, no investigation, or no blood test in my study because I will use retrospective data. That is for beneficence, that there will be no direct benefit to the subject in my study, but the result and the conclusion of my research will provide evidence to clinician and policymaker, and to maximize it will maximize the potential benefit to the future patients regarding the use of statins, or maybe updating their guideline, but it's quite a bit far from my ability. And the nature of my study is risk-benefit study, so I already take into account both not only effectiveness but also the safety outcomes of statins. So the potential benefit for generating the evidence from my study, it's usually outweigh the risks to the participant. Because this is observational studies, that's why there's no additional intervention to the subjects. That's why there is no additional risks from my study. And the allocation of the subject, educational treatment to either high or moderate intensity will be done by their clinician and or patient shared decision making based on their own risk profile. So it can use the best benefit and no additional risks from my study as well. And I will try to strictly obey the standard operating procedure like strict data protection protocol like encrypted storage device, for example. And the enforcement of BDV in Thailand will protect against misuse of sensitive information of my subjects, or sometimes called data breach. For gestics, so to make fair subject selection, so I already have explicit inclusion-exclusion criteria to make sure that the subject selection is representative of the population of patient with coronary artery disease. So this is the first point. Another point is that the finding, I will disseminate the finding to policymaker of at least Thailand or probably publish in peer-reviewed journal to disseminate my information to all those are in need. So this is the budget, my proposed budget. For proposal protocol development, there is no cost. IRB submission, and according to previous agenda comments, so I need to remove these 10,000 Thai baht. For statistical analysis, the main objective of statistical analysis is for inclusion of some software like RACE603, and for antivirus software Kaspersky, if other people might want to use, but I'm using Mac and I don't need, but this is for other person that help in my project, maybe research assistance. And for manuscript preparation, so writing manuscripts according to the general oral lecture. If we submit our proposal, then the faculty or graduate give 30,000 Thai baht, right? That's why I included it here. And there might be the send fee for English proofing. And here the publication fee means APF, article processing fee, if I publish my research finding on peer review journal. So I calculated 90,000, but according to the rate of 250,000 US dollars. It is the average for most journals. And there might be the research assistant to help me, because in some cases, as some agent mentioned earlier, so most of the records are in Thai language. Even though I can use Google translators, it is better to hire another research assistant in my initial PDF. That's why I included 15,000 Thai baht. There is no patient-related cost, but there might be data entry and the cost for data entry and data cleaning. So in this line, so I am thinking to give these budget to the person who help in data entry or data cleaning, maybe the data scientist and the data management as well. They have the same line, but I divided to get an additional budget. There is no site-related cost because this is retrospective course. So the grand total maybe 200,000, a little bit more than 200,000 Thai baht. So this is the Gantt chart or the timeline for my research. Here the proposal, I'm thinking to take 3 months for proposal development because I'm thinking to involve cost effectiveness, not only clinical effectiveness, but also cost effectiveness. That's why I take another 2 months. For clinical effectiveness, I can finish within 1 month. But I have to read a little bit more for cost effectiveness. That's why I want to spend 3 months for proposal development and then ethical approval. For data collections, I'm thinking to spend 6 months. It's at least, but according to my initial calculation, so the total record may be around about 100,000. So if I need to finish within 6 months, I have to finish at least 560 record per day. So it is quite difficult. But with the help of data scientists and other AI tools, it might help, and it is possible to complete within 6 months. And the data cleaning and validation, 2 months, statistical analysis, 1 month, writing proposal, manuscript, maximum 3 months, and the submission. So it takes total of 16 months for these projects. So this is the end of my presentation, and thank you for your attention.
Okay, thank you very much. Any question from student?
What about the limitation and strength of the study?
Okay, limitation.
Strength
Firstly, I
and
want-
limitation of your proposal.
Yeah. Firstly, I would like to start with the strength of my proposal. So because I'm using the real world data of Rama, so it is one of the strength. It reflects the real saturation of the population in Thailand who are suffering from coronary artery disease. This is first. And the second one is that there might be very large sample size. It helps in terms of statistical power. So this is another advantages. And the way that I'm thinking to categorize patients, high intensity or moderate intensity, reflect the actual clinical practice. That might be another strength. And I'm thinking to use counterfactual approach, treatment effect model. So it is the statistical advantages to minimize confounder and selection bias. But it does not necessarily mean I can remove all confounder. So again, on the other hand, in terms of limitations, so although I'm thinking to use counterfactual approach, so there might be, and it is not the real RCD, it is an emulate RCD, not real RCD. So there might be some uncontrolled confounder in compared to the real RCD. And another thing is that because I didn't make the real analysis, so there may be another limitation, but it might be due to the research design, retrospective cohort. So it is lost to follow-up. There might be some proportion of loss to follow-up that might affect the validity of my study. And what else? Yes, that's all.
Have any comment, Tun, Tun? Is it okay for you?
Yes, thank you, Ajay.
Any point to add?
Yes. For the budget, you will spend about 200,000. So are you going to apply for grant?
Yeah, yes.
As for any from other student that you use the data from hospital database, right? Maybe you have to prepare the budget for the data retrieval.
Are you thinking of performing counterfactual prediction model or
Yes, yes.
or individualized treatment effect model?
Yeah.
You may need to think of external validation.
External validation.
Yes.
I have no idea how should I, how can I do for the external?
Well, you have to review how to do external validation, okay? You have to read the articles. A few articles are talking about how to construct prediction model by TPOT guideline, and that TPOT guideline also included or mentioned about the methodologies that should be conducted and to be concerned when you develop prediction model, any type of prediction model. It could be prediction model of disease prognosis or risk study. And then here that you are not just only the disease prognosis, but you are interested in the treatment effect and identify the persons or the patients who may gain more benefit from the treatment, high dose or intensified dosage of study. To do this, that if you're going to encourage people to use your model later, that you really need to do external validation. And you can read the methodology from there, concerned about internal validations and external validation for development of prediction models, okay? And also, the article that I circulated to you guys that just published in Clinical Epidemiology last week, that you should read that as well about the issues concerning external validation. A few proposals for constructing prediction models may not need to do external validation. So you need to read that as well, okay, the new concept. And you have a study on the cost advanced statistical analysis, RACE603, that the part of the model development, derived model, and validation. So that you should learn from there and read more articles related to the prediction model.
For my case, so in order to make external validation, so from where can I get the data to make external validation? Even though I can create prediction model.
Yes, you need to discuss with the team. We have a neighbor nearby, the hospital nearby, Raamath Hospital, or even Washira Hospital, and then you may need to imagine, or even in Myanmar, you may need to imagine, pretend like it can happen, how will you do? And then you may need to think of the cost to retrieve the data from another field site as well for external validation. So here you are, you need to imagine. Now, with feasibility, now the feasibility might be less or more, or even it can be happen, or well, at the end of the day, that you need to critique yourself, but you need to think of how to design the study to make it more valid, in terms of construction, the prediction, the counterfactual prediction model. Okay. And some part you should be able to do, some other part you might be able to do, but you think in advance, and at the end that some of them that you might be able to do, but some other you might not be able to do, but what's the reason? And again, that the cost now for writing the manuscript, it's very expensive, or very cheap to me. And the publication fee is okay. That is Q1, Q1 journal, very expensive as well, nearly 100,000. But the cost now for manuscript writing and English proofing, that we are not going to pay. We are not going to pay for that.
Any comment ค่ะ
Are you sure you're going to finish the analysis within 1 month?
Analysis within 1 month. If there is clean data sets, it is not extendable as I mentioned recently. So for usual analysis, it is possible. Because I spend most of the time I'm really happy to do that kind of analysis. And I'm also suffering from insomnia, so I spend most of the time at night.
Yeah, I know, but is it possible to do parallelly with the
Other job.
with the data cleaning, right? Because
No,
probably
it's impossible. I will first do data retrieval and then data cleaning. After completion of data cleaning, then analysis. Otherwise, it's impossible.
because
And
you
it is
you
only
you
for
make a
my
lot of
site.
no, because I think you would make a lot of time for data cleaning.
Yeah.
So I'm not sure whether while you are doing some portion of the data cleaning, you can do some analysis. For example, if you do the cleaning for the baseline, you can do some analysis of the baseline, something like that. I mean,
Yes, it is quite difficult. Within 6 months, 6 plus 3, 9 months.
Prepare the time for data analysis, even though that you have work on cleaning and checking the data and that data pre-processing. I mean, and that you are very sure with your data based on your data at that time, and you afterward that you may need to think of imputation, which takes time for imputation. Takes time, and then after imputation, data analysis. And I tell you what, that sometimes data analysis is very straightforward, but cleaning, checking data and prepare the data in order to allow you to analyze data, and that will take time, will take long time, and including imputation. But if you are unlucky, data analysis also taking time as well. If you are unlucky, you can spend not 5 minutes, or you can spend even a month, still not final, still cannot come up with a final conclusion, because the data analysis depends on how many outcomes there are, and for each outcomes, the treatment model or the outcome model that may not be valid, or it may not be comply with the assumptions, and then you try to work out how to reconstruct the model properly in order to come up with valid model, something like this. So if you have more than one outcome and you have how many possible models will have to be constructed, and then along with meeting with the team regularly, and that you can move step by step. Don't be rush yourself for this part, because as I mentioned, if you are lucky, it's straightforward, but most of the time, I'm lucky, and then you have to fishing, and you have to export the data, you have to fill in the data, and then you have to go back to check the data with something, even though that you are pretty sure that your data is clean, that something later on might be explored and found later that it's unusual interpretation, or the result look very strange, and you have to go back to dig the data and to prepare the data. So normally data analysis, particularly for big data and real data, that you may need to prepare for 3 to even 4 months sometimes.
Any question? and comment. This is the last topic, right? But we will have the final presentation after this class.
So the final presentation will will be as a whole proposal, right? Started from background, rationale for conducting the study, research question, research objective, and methods.
Yes.
Right?
Yes.
Okay.
So, but I would like you to revise your assignment and slide according to the comment and suggestion from your colleague and Ajahn. Okay.
Yes, I will. We will definitely because here I would like to make some comment about these course because it is positive comment because during these course and discussions I read my proposal again and I found several weakness. So it may take time to revise because why I see several weakness because of the course of structure. It equipped me with more knowledge. That's why I can see my weakness because at the very beginnings, I put my greatest way to make these proposal, but later I see and I saw that there's a lot that I can improve my writing in terms of design, analysis, and many other things. So thank you so much for for this course, organizing this course.
Thank you so much for your effort to all of your effort to this.
So you could see that now our lecturers, now your lecturers here, that we try to give you suggestion and comments in order to let you move forward now with direction. Because you are training in clinical epidemiology, medical epidemiology, so that research methodology should be very strict, very tough. Like data retrieval, data linkage, database